AM 1450, FM 99.3 KNSI. Welcome to Your Health, a new program here on KNSI that features local health experts from CentraCare. Now, that word local is very important because these people are your neighbors. They're folks you see all the time at school with the kids, the grocery store. They live here. They work here in central Minnesota. And that is important because these people know firsthand about the health issues that affect you because they also are impacted by these same factors. They just happen to be healthcare professionals at CentraCare. Our guest today is Kasey Cable, Tobacco Prevention Program Manager at CentraCare and Feeling Good, Minnesota. Kasey, welcome to Your Health.
Good morning, Bob. Thanks for having me.
Tobacco, it would seem that we are seeing a bit of a resurgence, are we not?
Unfortunately, the first time in 17 years we've seen an uptick in youth tobacco use this year.
Why?
The electronic cigarette industry has hit home, specifically in Minnesota, pretty hard.
You and I were talking off the air about the fact that there was a time when you used to see cigarette advertising on television. You would hear it on the radio. Those days are gone. And I was so surprised to see electronic cigarettes are back in media.
Heavily. We know that about 88% of local high school teens have been victims of some sort of electronic cigarette advertising, whether that's in the magazines that they read, in the Netflix shows that they watch, on radio. Unfortunately, it's been a really popular item that teens are seeing.
We have commercials here that talk about people being away from smoking for years, and now they're coming back. They're coming back to smoking like it's some amazing experience, right?
I think people think that it's the cool thing to do, whether that's people that are coming back to tobacco use or using electronic cigarettes as a way to get away from smoking.
Well, nicotine, as far as I know, is still as addictive as ever, isn't it?
Absolutely.
As far as I know, people who have tobacco companies are still putting things in the tobacco, in the nicotine, that make them even more addictive, are they not?
They are. And now we have actual combustible tobacco companies that are buying into these electronic cigarette tobacco industries. They know they're on to something. They know they're hitting kids that are young. 15, 16, 17 is really that prime age. So now they're able to get those replacement smokers, early teens, and we have cigarette companies joining electronic cigarette companies. Replacement
smokers. What a great term, because you know what happens to the original smokers? They die. You think I'm anti-smoking? I am. Really, truly am. Used to listen to my mom and my dad cough up a half a lung every morning. That was my alarm clock. How nice. How nice. All right, we need to talk about some other things here. We're going to talk about some of the stats, some of the common tobacco products, health impacts, that sort of thing. What can we say to our kids? And we're going to come back and ask the same question toward the end of this conversation. But what can we say to our kids to tell them, listen, it's not as cool as the advertisers make it seem?
It's really hard when we're talking to young people right now about the long-term effects of electronic cigarettes, which the majority of them are using, because we can't take in a black lung to schools like we used to do, or we don't necessarily know the correlation between electronic cigarettes and lung cancer or COPD. We really haven't been studying them long enough.
I haven't had time, right?
Exactly. They've only really been in the U.S. since 2007, and they've only been regulated for about the last 5 years. So what we do know is this nicotine addiction, which you brought up, Bob, and electronic cigarettes are able to produce this nicotine hit for students so much faster, for users, I should say, really in general, not just for students. So we're really seeing this nicotine addiction with kids that use these. So when we're talking to high schoolers, their attention span can be less. They're really fidgety. They're saying that they're getting this urge or an actual addiction or withdrawal just during the school day. So they're having to find windows for them to be able to use during school.
Wait a minute. School people are having to find windows for these kids, or the kids are taking it upon themselves?
The kids are trying to find windows of opportunity.
Gotcha. Sneak into the bathroom like they used to all the time.
Exactly. And a lot of students that you talk to will say, our bathrooms are known as vape lounges now, or we had a local principal that said, it's crazy because my school's bathrooms have never smelled so good.
Isn't that, and it's the flavored vapes, right, that are making it smell so good.
Exactly. Nearly 8,000 flavors on the market right now.
Well, let's talk about the marketing to these kids as well. And I think you kind of touched on it before. All the flavors, all this stuff, all the cool electronic gizmos, right? And that's where it's at. Oh,
absolutely. There's these small, sleek designs like the Jewel that we talked about, which really dominates the market. Or for the do-it-yourself or really technology-inclined students, you can buy pieces off the internet or at local shops and build your own.
Sure.
And you can get skins to cover, decals and labels similar to what you would put on your computers. And so it's really something that allows students to express their individuality. It's the new thing. It's providing them.
It's perfect for these kids. I mean, think about what you're saying, right? The individuality, and every child is in that time of their life trying to find out who they are. Well, you're a vapor. Hey, I can join the club.
Exactly.
Right? I can be a part of the family. Do we know what the impact is, dollars and cents wise yet, or is it still too early?
For electronic cigarettes specifically, it's really early.
Okay.
We still know in general tobacco-related costs are costing Minnesota about $3 billion a year. You and I, individuals, man, woman, child, are paying just about under $600 in tobacco-related disease prevention, loss of productivity, things like that in the state of Minnesota.
I'm paying how much?
Yeah, nearly $600, Bob, it's costing you.
Good heavens. We need to do something about this, my friends, which is one of the reasons why we have Kasey Cable in studio today. Education can go a long way, right?
Absolutely.
So we see these. I see the one commercial on television where these three boys are walking down. Hey, have you tried Dragon's Breath? Have you tried this? Have you tried that? Really cool. To me, it sounds like the first time I saw that, it was like a video game. That's what I thought it was a video game advertisement, right? But no, it's all about vaping.
The names of these products are crazy.
Very cool.
Oh, super cool. They know exactly what they're doing. They're feeding into their target market. And we have students that don't know the harms of these devices or what nicotine is going to do to impact them. So, hey, my friend has this, new Dragon's Blood vape, and I'm going to take a puff of it. Well, we know that the effects of nicotine are so fast that we're seeing students that can be addicted in just a couple of times.
AM 1450, FM 99.3 KNSI. We're talking about you and your health, your kids and their health as well. Kasey Cable is our guest, talking the problems about vaping. AM 1450, FM 99.3 KNSI. Back with more of your health. Our guest today, Kasey Cable. And we are talking with Kasey about this issue, this problem that we have of vaping. Is it a problem?
Absolutely.
Okay. Now, when you say that, why is it a problem?
We know that electronic cigarettes have contributed to the downward incline of youth tobacco use for the first time in 17 years. We know that, unfortunately, only about 50% of Minnesota state is protecting its residents with clean indoor air acts that include electronic cigarettes.
Okay.
So right now we're renormalizing the use of tobacco products in everyday places like restaurants. In St. Cloud, we don't have e-cigarettes included in clean indoor air, so you could take your young child out or grandchild in your case, and they could see someone in the booth next to you using. So
electronic cigarettes are a completely different classification than a Pall Mall or a Kool or a whatever, right?
Yes, you're not lighting them. Essentially, an electronic cigarette has it's a battery-operated device. Okay. You have a battery, an atomizer, and a tank. And through a battery heating up that e-juice, you're able to produce this vapor. So you're still inhaling whatever's coming out, of your e-cigarette, whatever sort of juice you're putting in and flavoring. And we talked about those nearly 8,000 flavors on the market right now. And then you're producing this cloud of vapor. Depending on what device you're using, what sort of vapor you're using, it's really customizable. So you could have a big battery or a big tank or a different oil, and you can produce these huge clouds. Off the air, I know you were talking about sometimes you see this big cloud of smoke coming out of somebody's
car window or somebody walking down the street. I mean, this enormous, way larger than any regular exhalation of if they were smoking a cigarette,
And unfortunately, you've got young people that are on the internet watching cloud chasing competitions where people are actually battling who can make the biggest shape out of their cloud or produce the biggest vapor. So we know that
really after these kids, aren't they?
Unfortunately, we need replacement smokers, according to the industry.
Yeah.
We know that current tobacco users are going to either be dying off because of tobacco use or old age or other, implications of using, and they need to replace those.
So are these new tobacco companies, are these new electronic cigarette people, are they brand new to the industry, or is it R.J. Reynolds coming up with a new way to skin the same old cat?
It's a little bit of both. We definitely have some small industry folks and, where you can go in and walk into a mom and pop shop and get your items, or it's Altria that's just bought into Juul Labs. And they've been around forever, and they know that the market share is changing, and they know that Juul Labs is doing something right, and they're jumping on board.
Is it legal for someone under the age of 18 or 18 or younger to purchase a Juul?
In Minnesota, it is not.
It is not. So it is still illegal to vape if you're below the age of 18?
Correct.
Okay. I didn't know that. Okay. And I don't know if parents are aware of that or as aware perhaps as they should be.
I think that's a really great point you're making. We talk about what parents know and what they don't know.
Sure.
And electronic cigarettes are something that are ever changing. They don't look like a combustible cigarette. They don't smell like a...
They smell great.
Yes, exactly. So not all parents understand that this is a device that's not only could have legal implications for your child, but long-term health effects. We could talk about dual use and addiction to nicotine. So that's something that we're really trying to do is educate folks in the community, whether it's parents, aunts and uncles, grandparents, older siblings, and saying, here are all the consequences surrounding electronic cigarettes. And this is what we're trying to do to make those really clear for people that live in central Minnesota.
Okay, because these are quote-unquote electronic cigarettes, the existing tobacco rules and regulations just do not apply because it's a different product.
Electronic cigarettes are actually deemed tobacco products. They are. That happened in 2016 with the FDA. So when we talk about things like licensing ordinances for people that are selling tobacco products, those rules apply to electronic cigarettes and combustible cigarettes, any tobacco product. When we talk about things like Minnesota's clean indoor air, the way some of those legal documents are written, there are loopholes or areas of exploitation. So unfortunately, the way Minnesota's clean indoor air is written, which is really the biggest lacking area of when we're talking about e-cigarette use, e-cigarettes are not defined in that act. So we have a lot of local cities that are trying to include e-cigarettes in clean indoor air. So we just know, nope, this is going to be clear. You can't use it at work.
Right.
You can't use it inside my restaurant. You can't use it at the bar. And as well, the state of Minnesota is currently looking at a bill this legislative session, to add electronic cigarettes to cover the entire state of Minnesota.
It's so crazy, isn't it, that it takes an act of Congress literally to do something like this. And all it is smart lawyers, hats off because they're inside the legal loopholes, right? And that's all they're doing is finding another way to exploit the law to make money, period.
Absolutely.
How's that make you folks feel? To me, the blood starts to boil again.
Boiled blood is probably an electronic cigarette flavor.
It probably. Kasey Cable is our guest, and we are talking about vaping, electronic cigarettes. Did you say that $3 billion in excess healthcare costs is what we're all part of now with this vaping? Excess
healthcare costs, lost productivity. We have individuals that are suffering tobacco illnesses that can't come to work. We have individuals that are continually coming to the ER
because they're vaping.
This is talking general.
Okay.
Yep, all tobacco use. Really, we just haven't studied electronic cigarettes long enough to pinpoint what exact health effects, aside from the nicotine effects we've talked about, are coming from electronic cigarettes.
Yeah.
There's the anomaly event that happens when an electronic cigarette blows up in someone's face or
right,
in
I've
their
read
pocket. So we do have those, which are very traumatic.
Yeah. But thank God they're few and far between.
Exactly.
I mean, let's get back to the whole addictiveness of a jewel of liquid nicotine, if you will, the various levels of concentration that we find in these electronic cigarettes, because a cigarette, as opposed to, a box of e-juice or a vial of e-juice, is there a difference?
Absolutely. We have a slide that we show parents and community members on this presentation that we give, and it's probably it's the slide that we received the most
oh my gosh, yeah.
Reaction from. So it talks about the different levels of nicotine in these devices. And we start out saying a regular, quote unquote, normal combustible cigarette has about 18 milligrams per milliliter conversion of nicotine. A Juul pod has 59. We know that a Juul pod holds as much nicotine as a whole pack of cigarettes. And that's about 200 puffs. But that's a real generalization, Bob. So we talk to different students and say, how long does it take you to go through a pod? And we don't really have an answer. Mm-hmm. We hear that some students can say, I can go through one in a day at school, or I could go through a pack of pods at a party. Yeah. The problem is we know that electronic cigarettes are such a social device.
Right. And they're sharing them, right?
Students are sharing them.
Yeah.
So we don't know exactly how much of that nicotine is being absorbed by one user, but going from 18 to 59 when you're talking about nicotine concentration in one.
That's more than 3 times. So that'd be like having 3 cigarettes at one time, smoking 3 cigarettes at a time, right?
And this is the nicotine we're giving to young, undeveloped brains.
You know what? Can we talk about that just a little bit? Because I know that when you have children, it is so important as they move along in their various stages of life that their brain has the opportunity to fully develop, right? In the right way. Schoolwork, all these things, social interaction, becoming a member of society that can function and contribute. What are we finding out here with electronic cigarettes and the development of these kids?
So what we know is that we really want to get students to that 25, 26 age range. That's when we know brains are really kind of ending their development stage. So when we're talking about 14, 15, 16-year-olds that are taking in all this nicotine from a Juul, they're actually changing the way their brain chemistry works. They're learning addiction. We know that students are going to be more susceptible to using other drugs when they use this much nicotine. We know that they're twice as likely to use combustible cigarettes. Mm-hmm. And we're really seeing effects in the classroom. You talk to teachers and administrators, and we have students that are fidgety and their attention span is less. And we know that those are direct correlations to the amount of nicotine that these students are getting.
AM 1450, FM 99.3, KNSI. Kasey Cable is our guest. We're talking about vaping and your kids. After all, it is your health that we're talking about here as well. Kacey, you had mentioned that you do presentations. I want to find out what we can do to have you come by and talk to our local service group or what have you. Want to find out about legislation, what's being done to regulate the use of e-cigarettes. So much more to come. Stay with us. AM 1450, FM 99.3, KNSI. You are listening to Your Health. AM 1450, FM 99.3, KNSI. Your Health, our final segment today with Kasey Cable. We're talking about tobacco use. We're talking about vaping and your kids. First off, right out of the chute, Kacey, if folks want to have you or someone from your organization stop by and educate them on vaping, what's really going on, what can we do?
You can definitely reach out to us. Find our emails on our website, feelinggoodmn.org.
Okay.
And we'd be glad to schedule something to come out.
Also, CentraCare.com/services/tobacco. You can go there, too, if you want to go through all those slashes and all that kind of stuff. What about being 21 as opposed to 18? You know, you had mentioned 26 is kind of the demarcation line for developing brains, that sort of thing. Are you a supporter of the organization, a supporter of 21 years old to be able to buy this stuff?
We are. Tobacco 21 is something that's taking over not just Minnesota, but the entire country.
Okay.
When we talk about other controlled substances, alcohol, or states that have recreational marijuana, that's 21 in different places as well. We know that 79% of students that are using electronic cigarettes are getting them from other people, whether that's friends, parents, older peers.
Stealing them.
Exactly.
Whatever.
And when you're 18, you could go and buy them and bring them to practice the next day or homeroom and distribute them, which we know happens locally. So what we're trying to do with this Tobacco 21 initiative is increase that gap between students that are in high school and around impressionable younger classmen and able to purchase these devices in the community.
We had a story the other day. Some schools are banning certain long-sleeved or hooded sweatshirts because kids are finding a way to hide their jewels inside their sleeves.
Vaporware.
Yeah.
I wish.
Vaporware.
Yes.
There's a whole product line, isn't there?
There's a whole line. Yes, you can plug your jewel into the string and vape out the other side of it.
It's too weird. It's just too weird for me. So other than that, moms and dads can sit down and talk with their kids. Are kids going to listen? You know, we're going to try to scare the bejeepers out of them. Is there a different way to approach kids and e-cigarettes?
I think it's talking early and talking often, whether that's parents that are continually having conversations, organizations like CentraCare being able to educate educators, and strengthening local laws and ordinances so we can reduce the renormalization of tobacco use. We can be sure that parents aren't vaping while they're watching sporting events.
Kids will do what you do. There is no doubt.
Absolutely.
Again, CentraCare.com/services/tobacco-treatments, where you can go if you are a smoker and you want to get the help that you need to stop. There are many, many other initiatives that are underway right now. But again, it's pretty simple. You can, if your child's room suddenly smells delicious and fruity, something's going on, Mom and Dad.
I don't know a whole bunch of kids that are rushing out to buy dragon's blood cherry scented candles.
Kids will do what we'll let them. There's no doubt about that. And again, this whole e-cigarette thing seems a little foreign. Maybe not to younger moms and dads, but you know, for us folks who have been around the block a time or 10, it's just amazing to me. There's another way, and we're smart enough, right? But we're not. Does that make sense?
Totally.
Kacey, thank you so much for stopping in today. Appreciate your help.
Thank you, Bob.
Your Health with Kasey Cable, Tobacco Prevention Program Manager at CentraCare and Feeling Good, Minnesota. AM 1450, FM 99.3, KNSI.